Hey everybody, it's Matt Cavallo. I've got a special guest with me here today. It's my little brother Michael.
How you doing?
So I wanted to bring Michael on today because we had a very good conversation, and it brought up the question, in the hospital setting, is everyone treated equal? And I think my brother has had a very interesting patient experience that all of you would benefit from. First of all, Michael, if I gave them just a brief history, you were, what was it, coming out of high school, you were about top 100 hockey players in Massachusetts?
Yeah, probably right around there in New England. Yeah.
And then you went up for a year at prep school.
Right.
And that's where your first injury happened.
Yep. I was playing football up at Tilton School, and I broke my tibia or tibia plateau. It was a devastating knee injury, especially for someone who was up there on a hockey scholarship, and I thought my career was over, but it between rehabilitation and a lot of hard work, I was able to play half a season at Tilton and then move on to college.
And that didn't stop you at all. You went on to play D1 hockey down in Fairfield, Connecticut.
Yeah, small Division I. We went Division I my sophomore year. There was about 8. Ended up being 10 teams that formed the MAP conference. But
now, when you were playing Division I hockey, coming from a smaller school, is it fair to say you were playing with much larger people when you went from the smaller division up to D1?
Yeah, we went from D3 to D1, and it was from freshman year to sophomore year. So, and it was, you could put it this way: we were a little bit above 500, I believe, my freshman year, and my sophomore year we won one game. So,
well, not only did you just win one game, but did anything happen to you physically as a result of making that jump?
Well, I mean, everyone was bigger, faster, stronger. I had another knee surgery my freshman year, so that was 2 surgeries within a 12-month period, 13-month period, and there was just, the competition was better, and everyone was stronger, and I needed to do certain things in order to be up for that competition.
In addition to the knee injuries, did you injure anything else?
I had multiple concussions, which ended up eventually ending my hockey career by my senior year. My neurologist said that unless you're planning on signing a multi-million-dollar contract playing professional hockey, which I wasn't, I would strongly suggest that you hang up the skates, and that's what I eventually ended up doing my senior year.
And as your older brother, I remember that being a very tough period in your life, not only for you, but for mom and dad. They used to make the 3-hour drives down to see you play hockey, and all the other people that had supported you throughout your hockey career. It was a devastating loss for all of us. Now, when you were going through these injuries and surgeries as a star athlete, how was your patient experience in the hospital?
Oh, it was amazing. From my football injury, which was in the fall of 1996, all the way throughout college, which I ended up graduating in 2002, but I played hockey through 2000, 2001, and I was in the hospital a lot. I was in doctor's visits, neurology, different surgeons for different surgeries that I had. But I mean, overall, even when I had a hockey injury later on, into my late 20s, I believe it was, or right around the age of 30, I tore my shoulder playing hockey in a pickup game, you know, and you got treated a certain way as an athlete, you know, with
yeah, because a lot of people remembered you back home from being, you know, one of the top high school players in the state. I want to talk a little bit about that shoulder injury, because something happened with that shoulder injury. You left the hospital with a repaired shoulder, but what else did you leave with?
Well, obviously, you know, there was shoulder surgeries specifically are very, they're difficult to, you can't put a cast on a shoulder, you know what I mean? So after you get a surgery, whether it's microscopic or they tear you open, you know, they put you in a sling and you kind of just have to deal with the pain either by, or both by medication and the different icing and cooling machines that they have that, like, you know, they fill up with cold water, they wrap around your shoulder. But, you know, I mostly dealt with it through pain medication.
So what kind of pain meds were you on?
Just, I mean, everything that I was used to taking from the time I was 18 years old after my first knee surgery, which was oxycodone, oxycontin, Vicodin. Those are basically the big three.
Now, when the prescriptions for the pain medicine ran out, did you have an easy time transitioning from pain medicine to a life without pain, or had your pain not resolved?
No, I mean, I've pretty much been in constant pain ever since I was a college athlete, and for somebody like me, especially when, you know, hockey stopped on a collegiate level, you know, and it's almost just kind of like you're a different person then.
Mm-hmm.
You know, it's like, well, people aren't rooting for you as much to, you know, or I guess asking if you're doing better, or like how the pain is, or are you able to manage your medications, are you able to manage your life? And for me, I wasn't able to do either, you know, and unfortunately it took a long time for me to realize that, and for a lot of other people.
So when you couldn't get your pain meds anymore, did you turn to other ways of self-medicating?
Well, yeah, because they eventually they cut you off from your medication, especially if they find out that you've had any sort of issues with whether it's drug addiction or alcoholism or anything like that. If any of those, they flag you essentially at hospitals and doctors' offices, and they're quick to give you those medications, but they're also just as quick to take them away. And to leave someone like me out there after relying on certain medications and then
for
just
a long time,
and then just taking them away, it's.
So what did you do? Where did you turn to kind of deal with the pain?
Well, I mean, first I turned to other people that I played hockey with, you know, that were experiencing similar, I guess, lasting effects from injuries or things of that nature. And, you know, we were, myself and a couple of my ex-teammates and friends, you know, were able to kind of help each other out. But, you know, essentially it's you getting those medications on the street, getting them from somebody who is obviously not a doctor and obviously doesn't have any sort of
You lose money fast that way, right?
Oh, I mean, to buy, you know, a 30 milligram oxycodone on the street costs $35.
Wow.
You know, for one pill.
So obviously you got to look for a cheaper alternative. So What did you find?
I ended up finding that heroin was a cheaper alternative.
Mm-hmm.
And that was something that I found out when I first realized that I finally realized that I was really having a problem. I went to a detox, and every kid in there pretty much told me that I was crazy to be spending the money that I was spending on oxycodone and oxycontin, that heroin does the same job for half the price.
Wow.
So I ended up finding it with a person that I met at that first detox later on the next week after I got out.
And I know you fell into the heroin cycle for a while, and we're celebrating your sobriety today. Thank goodness for that. But you had some health scares when you were on heroin, and you ended up in the hospital a couple of times. And I wanted to ask, you were somebody who was in the papers growing up, recognized, multiple towns around the South Shore as being one of the better hockey players, played for a private school, very high exposure. Like you said, you had a lot of very positive hospital experiences. How was it going back to the hospital as a heroin addict? How were you treated this time versus Mike Cavallo, hockey star?
It was difficult. I remember specifically one time being rushed into the emergency room via ambulance, and Mom was actually with me, and it almost felt like I was being treated like a second-class citizen, or that I was.
Did they know right away that you were in there?
Oh yeah,
for drugs?
Well, that initial time I was being brought in there for, an incident that had happened as a result of drug use. Yes, and so the people working in the emergency room, they know as you're coming in, and I couldn't really speak at the time, but I talked to Mom about it later on. There was just this sense of like it was like a shaming, guilt feeling, coming from these people that were supposed to be taking care of me. And on more than one occasion, I've been, almost had morphine pushed on me, knowing like my history and knowing that I'm not supposed to take things like that, no matter what.
Yeah.
Even if I was coming in there from a car accident and had a very serious injury, like if I could talk, I would tell them not to give me that. So besides the sort of attitude and talking down to me, essentially, I was very surprised at a couple of different occasions where I was actually, offered medications that were, that could be very dangerous to somebody like me.
Well, and before we talk about that, there's one thing that you and I had talked about, where you said, and I don't remember the exact context, so you're going to have to help me out here, but you and I were talking a couple months back, and you said, somebody came in your room and they were all happy until they read your chart, and then you could actually see the look on their face change and their whole demeanor change, and the way they treated you changed after that.
Yeah, absolutely. Well, that's because I was sober on that particular occasion, and being forthright about. I made it known what my history was, and that I wanted to do the right thing, and the treatment didn't change whether I was coming in there as somebody who was experiencing an overdose or somebody that was coming in there in recovery. Just the fact that I had been flagged so many times at that particular hospital
as being an addict.
I could see it, I could feel it, I could hear it. I was asked repeatedly if I was on cocaine, and a substance that at the time when this question was asked to me, I hadn't done in over a year, and I'd said no the first time, and I said no the second time, and then the third time I started to get really aggravated, and it was the condescending, like, well, what do you expect? What do you expect me to think about somebody like you coming in here with chest pains? You know what I mean?
You got to admit that's hard, right? Because there is a history there.
Listen, I go to meetings. I go to meetings with nurses and doctors that are in recovery, and they talk about it. They talk about how it, like you said, the fatigue of having to deal with and watching people continuously go in there and die, and go back out and do the same thing and expect a different result and come back in. But, the fact of the matter is these people are sick,
And you're communicating to them that you're in recovery, you're there because you're having anxietable issues this time, right?
I didn't know that, but that ended up being what it was. I thought I was having like a heart attack, and it ended up being a panic attack. But I explained that I was walking out of a meeting when it happened. They took blood from me 2 different occasions. They took 2 EKGs. I was there all night, and at the end of the night, this was like how I was still being, talked to, and like it was.
And you told them that you were in recovery, that you were clean, that you hadn't done anything, and I believe you asked for no morphine. Is that correct?
I didn't ask. I said I don't want anything. Unless I ended up getting chewable Tylenol, but that was one of the occasions where a nurse literally was walking in to try to give me morphine, and 2 other nurses were like, we're going to take him and put him in another room. And at that time, the nurse who was holding the morphine in her hand said, "Oh, well, they'll take care of your pain over there." And I was like, I never asked you for any pain medication. It was bizarre. I think that was. I can't speculate on what was going on or what the protocol is, but I know it's not. I'm not a doctor, but I know it's not to give a recovering heroin addict morphine when he comes in there with chest pains, and is not complaining of any pains for, an hour or so. It was an isolated, like 3-second incident, and it ended up being a panic attack. But it wasn't like I was in there, just holding my chest in pain, saying, "Can someone please help me?" I was sitting here talking to them like I'm talking to you.
Yeah.
That was bizarre. But the thing is, it wasn't the first time that happened, and
it's a far cry from the treatment you used to have when you were the star hockey player.
Right.
Now, and I've known you your whole life, and I would say at this point in your life, you're at a period of reflection, doing the right thing, making sure that it takes tremendous courage to come out and talk about this stuff and share your story. But it's unfortunate that if I was reading your past story, that I would make any judgments to why you are in front of me right now. I would want, if you were coming to see me for some reason, I would want to have some kind of strategy to talk to you, to ask where you were at today, because I want to meet you where you're at currently. I don't want to see you where you used to be. And I want to give you that benefit of the doubt that people can change and people can go on and do the right thing. And I think that why ever you end up in a medical facility, you should be treated as a person. if there was anything that you would say, compassion fatigue is a big thing, right? Because, you know, a lot of people come in, a lot of people go out, and, you know, there is an epidemic, specifically around heroin. But the experience that you had as a star athlete versus a drug addict and now in recovery, they just seem to be progressively taking away from your experience as a patient and as a person. And would you agree that it's harder for you to want to participate in your own recovery when the people that are there to help you are making you feel like they're taking you down a notch or judging you in some way?
I mean, it's difficult. I mean, it definitely. I mean, one of the biggest things that I've had to learn, and like I know through your experience with MS, it's something that that is taught to people who go through struggles, that, you know, pain is the touchstone for a lot of growth, whether that be, you know, interpersonal or spiritual or emotional or physical. I mean, it's a fact of life, and not everybody is going to treat me with open arms. Not everybody's going to treat me with respect. And, you know, I'm taught that, especially when it comes to resentments, that if someone is talking down to me, or if somebody is trying to make me feel a certain way that is less than, then I'm supposed to treat them like a sick person, like a sick friend. You know, that's what I'm taught, but that's a far cry from what happens out in real life. And, like, you know, there are, and I'm not. When you asked me to do this, I was a little conflicted about it, because there have been so many people in the medical field that have helped me, but at the same time, there have been just as many that have really frustrated me, and and I'm human, so I can say all of these, you know, spiritual thoughts and altruistic ideas about how I would like to respond to somebody who doesn't treat me like I am their equal. But at the end of the day, I'm human, so I'm going to feel a certain way, and I just happen to be a sensitive guy, you know what I mean? And so, like, yeah, those, especially the last incident that happened between my last visit to Arizona and this one with the panic attack. Like, I left there, I had a really tough couple of days after that, you know, because I start questioning, like, am I really getting better? You know what I mean? To it, like, is their perception my reality? Things like that, you know. And I know it's not. I'm taught to fight through those fears, and to fight through those insecurities, and to fight through those judgments. But at the end of the day, they're gonna affect me in a negative way. And what I end up doing with that, like, I could just sit with it. I could have just told you, you know what, I don't feel comfortable about talking about this. Let's just do something else. Or I could do something like this. So, in my opinion, this is just another way for me to walk through those fears, to walk through those judgments, to walk through those insecurities.
Well, and I think it's great, and I want to thank you for doing this and sharing your story, because I think that the people that would be watching this would use this as a learning opportunity. And to close, I just want to ask you, when you look at him, do you see the star athlete? Do you see the drug addict? Or do you just see a person? And all I want to know is, when people come through the doors of your facility, do you treat everybody the same way? Or once you know somebody's story, does it change the way you feel about them? Thank you very much, Michael, for coming in and sharing your story.
No problem, brother.
And thank you guys very much for tuning in. We'll catch you next time.